Many seniors across the country are paying hundreds of dollars out of pocket every single month for healthcare costs that they could legally lower, cover, or eliminate completely. The primary reason people overpay is due to three deeply rooted, incorrect assumptions about federal savings programs. Most folks assume that if they own a home, have a modest pension, or have managed to build a small savings cushion for retirement, they are immediately disqualified. They believe these programs are strictly reserved for individuals with absolutely no assets and zero income. This misunderstanding keeps millions from even checking the guidelines, leaving thousands of dollars on the table every year. The reality is that federal rules, state-administered programs, and recent legislative updates are far more accommodating than most people realize. And understanding how these mechanisms work can dramatically alter your monthly retirement budget. The first major cost that seniors can eliminate is the standard Medicare Part B monthly premium. For the vast majority of beneficiaries, this cost is automatically deducted from their monthly Social Security check. When you look at the federal Medicare Savings Programs, there are four distinct tiers designed to assist individuals based on their financial profiles. The Qualified Medicare Beneficiary Program, the Specified Low-Income Medicare Beneficiary Program, the Qualifying Individual Program, and the Qualified Disabled and Working Individual Program. If you qualify for any of the first three tiers, your state's Medicaid infrastructure is legally required to take over the payment of your monthly Part B premium. This means the deduction stops, and that money is instantly added back into your monthly Social Security check. Beyond just covering the premium, the highest tier of these programs, the Qualified Medicare Beneficiary, or QMB status, provides an incredibly powerful legal shield against out-of-pocket medical bills. Under federal law, if you have QMB status, Medicare-approved doctors, hospitals, and providers are strictly prohibited from billing you for Medicare deductibles, coinsurance, or copayments for covered services. This practice is known as balance billing, and it is illegal for a provider to attempt to collect these funds from a QMB beneficiary. Even if the state Medicaid program does not pay the provider the full difference, the provider must accept the Medicare and Medicaid payment as payment in full. This protection can drop your out-of-pocket costs for doctor visits and hospital stays directly to zero. The second area where massive savings occur is through the federal Extra Help program, which focuses entirely on your prescription drug coverage under Medicare Part D. Many seniors struggle to afford their monthly medications, watching their deductibles and copays climb each year. The Extra Help program is a federal initiative that assists with the cost of Part D premiums, annual deductibles, and prescription co-payments. If you qualify for Extra Help, your monthly Part D plan premium can be reduced to $0. Your annual deductible is completely waived, and your prescription copays are capped at nominal, very low amounts. Just like the Medicare Savings Programs, the income and resource limits for Extra Help are adjusted annually, and certain assets like your primary home and your vehicle are completely excluded from the calculation. When it comes to prescription drugs, recent legislative updates have fundamentally changed how out-of-pocket expenses are handled. There is a universal annual cap on out-of-pocket prescription drug costs under Medicare Part D. However, seniors frequently confuse this absolute cap with the Medicare Prescription Payment Plan. It is vital to understand the difference. The annual cap places a hard legal ceiling on the maximum amount you can be forced to pay for your medications in a single calendar year. Once you hit that threshold, your covered Part D drugs cost you $0 for the remainder of that year. The Medicare Prescription Payment Plan, on the other hand, does not save you money or lower your total cost. Instead, it is a payment restructuring option. It allows you to take your out-of-pocket drug costs and spread them out into predictable monthly installments throughout the calendar year, which helps manage monthly cash flow, but does not reduce the ultimate bill. Another common financial trap involves preventive care visits and the phenomenon of surprise billing. Under the Affordable Care Act, Medicare covers a wide range of preventive services such as annual wellness visits, cardiovascular screenings, and specific immunizations, at zero cost to the beneficiary. However, a routine preventive visit can instantly trigger an unexpected charge if the conversation shifts during the appointment. If you bring up a new medical symptom, ask a doctor to evaluate a chronic condition, or if the physician performs a diagnostic test that goes beyond the strict federal definition of a preventive screening, the visit changes from preventive to diagnostic. The moment that shift happens, the doctor is legally permitted to bill you for a standard specialist visit, triggering your regular Medicare deductible and coinsurance. Seniors also frequently lose money by paying late enrollment penalties that may have been calculated incorrectly. If you do not sign up for Medicare Part B or Part D when you are first eligible, and you do not have creditable coverage from an employer, the government levies a lifetime financial penalty that is added to your monthly premium forever. However, mistakes happen frequently during the verification process. If you had valid coverage through a spouse's active employer plan, or if your previous insurer failed to properly document your creditable coverage, you have the legal right to challenge the penalty. By submitting the proper employer verification forms to the Social Security Administration, you can have the penalty recalculated or wiped out entirely, removing a permanent monthly surcharge from your retirement check. Finally, one of the biggest leaks in a senior's budget comes from simply accepting a denied Medicare claim. If Medicare or your Part D plan refuses to cover a specific medical procedure, doctor visit, or prescription medication, many people assume that the denial is final and pay the bill out of pocket. This is a critical error. The Medicare appeals process is a highly structured, multi-level system designed specifically to give beneficiaries a voice. A significant percentage of initial denials are overturned on appeal simply because the provider omitted a specific medical code or failed to attach the necessary documentation proving medical necessity. Navigating an appeal requires obtaining a detailed letter of medical necessity from your treating physician and submitting the appeal form within the strict federal timelines. Taking control of these costs requires immediate, structured action rather than passive waiting. Over the next 7 days, your primary objective should be to gather your financial statements, review your current Medicare summary notices for any unusual diagnostic charges, and check your eligibility for both the Medicare Savings Programs and extra help through your state's Medicaid portal or the Social Security Administration. These programs exist as a statutory right funded by your decades of tax contributions. Protecting your retirement income requires understanding the rules, questioning unexpected bills, challenging administrative errors, and actively claiming the federal cost-lowering protections that the law provides for you.